On one of our visits to Mumbai, the Eastern Mosiac team called on some of the city's most prominent cosmetic specialists to form an overview of recent developments in the field. South Africans now have access to similar procedures in our country. And for an update on what is available, Eastern Mosiac consulted with a leading local aesthetic expert.
Over the past couple of years, non-invasive cosmetic medicine has taken the world by storm, and the reasons speak for themselves. First of all, this alternative to cosmetic surgery involves no cutting of body or face, which means that there are fewer risks for the patients and the treatments are more affordable. But these are just some of the reasons. I find this science completely fascinating, so I decided to pay our leading aesthetic physician a call. With me, I have Dr. Anushka Reddy, an aesthetic physician from the Medi Sculpt clinic here in Ramsey. Dr. Reddy, welcome to Eastern Mosiac.
Thank you, Candice.
I think first things first, please explain to us what is an aesthetic physician and what do you specialize in?
An aesthetic physician is a doctor who specializes in non-invasive cosmetic medicine. And that simply put means not cutting the body or face in any way. Non-invasive cosmetic medicine could involve treatments for wrinkles, cellulite, spider veins, and a whole host of other problems.
And would you say that those are the main differences between your science and cosmetic surgery?
There's minimal side effects associated with it, so there's very little downtime or healing time. There's very little risk for the patient. It is a fairly cost-effective procedure and it is quick. Treatments like botox and fillers can be done in the office during your lunchtime, and you can just pop over back to your office or run off and pick up the kids.
And what are some of the treatments that you specialize in?
The cornerstone of my practice is mainly botox and dermal fillers. If you look at what botox does, it's mainly used to treat frown lines between your eyebrows, forehead lines, crow's feet, and you can even use it in the lower part of the face to treat chin lines. Whereas dermal fillers are used to soften your nasolabial folds. If I have to demonstrate that on myself, it's these lines that extend from your nose to the corner of your mouth. It's used to plump up lips. It's used to add volume to your cheeks.
One of Dr. Reddy's patients had agreed to allow Eastern Mosiac to capture the procedure on camera.
With me, I have Geeta. Geeta is a patient of Dr. Reddy's. Geeta, have you had non-invasive procedures done to you before?
Yes, I have. I've had my lips done and it's not painful at all. I was a bit skeptical about it, like most people, but I was pleasantly surprised and I really loved the result.
I hope you explained the process to us every step of the way.
Sure, no problem. Hi Geeta, how you doing? Come, do lie down. Geeta has had a procedure done before using dermal fillers. So today I'm going to be doing using botox, and I'm going to be doing an eyebrow lift on her. It's a fairly simple procedure. It's 2 little shots of botox. What we want to do basically is to lift the tail of the eyebrow. So a little bit of botox in there, and that's the look we want to create. I usually bring patients back after 10 days just to see, what has happened, and if she does need a little touch-up, then we can certainly do it at that point.
So I'll see you in 10 days' time to see if you've got the Aishwarya Rai eyebrow.
I'll just wink at you, Candice.
All right, so the tiny little injection. As you can see, the needle is very small, so Geeta shouldn't feel this at all. There we go. How are you doing, Geeta? Perfect. The important aspect when using botox is the precise placement of the botox. Because botox affects muscles, you don't want it seeping into muscles it should not be going into.
And Dr. Reddy, you were mentioning earlier the exact medical terminology for botox.
The active ingredient is botulinum toxin A, and there are different makes on the market at the moment. But in South Africa, our Medicine Control Council has only approved one for aesthetic use, and that's Botox.
Now, I was reading something very interesting recently, in that you can use Botox for your underarms to treat excessive sweating. Is that true?
We're having phenomenal results with it, and usually the effects last for up to 6 months. So it's a fairly safe procedure to do to treat underarm sweating.
And how are you feeling, Geeta?
I'm fine, I'm 100%. I didn't feel a thing.
Now, Dr. Reddy, from everything I've read, I know that this procedure is very popular in the West. But would you say it's grown in popularity in the East, particularly among the Indian community?
It's fast gaining popularity, especially in the East. If you look at the master courses in anti-aging medicine that's currently being offered, I mean, they started off in Paris, and they're currently, being offered in the East.
What are some of the misconceptions surrounding Botox and fillers, for instance?
Botox is a medication. It's administered by doctors, or I should say should be administered by doctors only. It is not a poison. It is a purified protein, and it does not contain any animal fats or alcohol for that matter. So, so it doesn't cause any religious conflicts as such. And that's why it's so popular in Dubai especially, and the rest of the Middle East.
And it's 100% safe.
Absolutely. The fillers are, there's no known allergies. They purified with hyaluronic acid, and there's no history of it having caused allergies.
Now, Dr. Reddy, how popular are these treatments for celebrities?
Extremely popular. Unfortunately, we can't mention any names here. But if you look at India, and it's a little known secret that entrance in these beauty pageants, and even your Bollywood stars, before a red carpet event, would prepare the skin for at least 6 months before such an event. Do you think all those Bollywood bombshells have naturally perfectly shaped eyebrows and doe-shaped eyes? Don't be fooled.
Would you say that non-invasive cosmetic medicine is gaining popularity amongst men?
Yes, absolutely. In the last 2 years, we've noticed a significant increase in the number of men we see at our practice. Men are certainly becoming more aware of themselves, and I must tell you, in India especially, Indian men are the biggest users of Botox.
Now, I'm very curious to find out more about the liquid facelift. What is it? I mean, it's hugely popular in the US at the moment.
It's exactly as the name suggests. It's a facelift, but it's non-surgical. So what we are doing with the facelift is we are using Botox and strategically placed fillers to create the effects of a facelift.
If this is meant to be exactly like a cosmetic facelift, for instance, what can you achieve?
First, it can mask bags under the eyes. It can plump out cheeks. It can soften these nasolabial lines. It can soften the jawline. We can elongate the chin. We can soften jowls. We use the volumizing fillers to mask the jowl, and that's the results we're getting. And these results usually last for 2 years.
With me, I have Dr. Reddy's second patient, that's Shireen. Shireen has never had any non-invasive cosmetic procedures done, but she's decided to have one done today. Shireen, are you a bit apprehensive?
A little bit, yes.
You've never had non-invasive cosmetic procedures before.
No,
what made
really.
you decide to have one today?
Well, a few friends of mine have had it and have seen the fantastic results they've had. And I just thought, well, I'm in my mid-40s and I might as well go for it.
What are you having done today, and what do you hope to achieve from it?
I'm going to have fillers done, nasolabial fillers, and I'm hoping to soften the lines on my face.
Now, I believe the first step in the process is to have your skin analyzed. So, Lilani, you'll help us with that and take us through the process.
Sure. If I could please ask you to put your chin there and look into the left mirror for me. Just keep it there.
And Lilani, when you mention mapping the face, what does that entail?
We basically map the face where the most problematic areas will be, according to the, where we'll have Botox done and fillers. So basically at the nasolabials and the crow's feet. And then we also look at some of the spots, pigmentation and so on. And we can also have a look at the pores and the texture. If you have a look at your pores, is 9%. You probably have more of an oily skin rather than a drier skin or maybe oily combination. Shireen, if you look at the texture, that's 8%.
Dr. Reddy, I see you preparing for Shireen's procedure.
Yes.
But whilst you're doing that, are there any long-term side effects from having continuous procedures involving dermal fillers or Botox?
Absolutely not, Candice. Dermal fillers, for example, are made of hyaluronic acid, and this is a natural component of cells. So with time, the hyaluronic acid is eventually broken down. So, there's absolutely no side effects that could possibly be associated with that. I should say that immediate side effects could be a little bit of bruising at the site of injection, but that's temporary and transient. That should resolve within a couple of days. So what I'm going to do to alleviate any discomfort is use a local anesthetic. This is a very slow injection local anesthetic can burn a little bit, so I like to give this very slowly. Almost done there. There we go. Just bear with me. Okay. How you feel? How's that? Quite numb? Right. So you can close your eyes. Close your eyes. Okay. Are you feeling that? How are you doing, Shri? Good. Excellent. You can see the filling effect almost immediately. How are you doing? Okay? Excellent.
Oh, that's amazing. You can definitely see the difference. Look at that. Pulled up so beautifully compared
And
to
you can
your
see the
left side of
depression,
the
yes.
face with-
The last part of the procedure involves a vigorous massage of this area. That's because the filler can, form some lumps and bumps. I'm very happy with the results. She doesn't need more than this. One filler per side. I'll bring her back after 10 days, see how it's looking once the swelling has settled, and if she does need a little touch-up, then we'll do it at that point. Are you happy, Mrs. Govender?
Yes, absolutely.
As long as you're happy, I'm happy.
You might get addicted to this. I can see why you have become so addictive.
Normally with procedures you have to wait a while, but this is immediate. It's unbelievable.
Well, I've had one of the most interesting days, and what I find most intriguing is that this science can also be approached as an art form. After all, the human body is a work of art, even though every now and then it's in need of a little bit of maintenance. Catch you next time.